Hi, and welcome to the Waterbury Hospital podcast. I'm your host, Jeremy Rodrigo. It's great to be with you again. Today, I have some special guests. I have an actual patient, Nick Poplaski, and his wife, Cynthia, actual patients that were serviced in our cardiac services department, and Mike Nolan. Mike Nolan heads up our cardiac services area, and he is a PA with us. And Nick's going to tell you his story. And it's a really interesting story about someone who was young. Nick's 36 years old. At the age of 35, he had a heart attack at his home in Naugatuck and was brought in by ambulance to Waterbury Hospital. And he's going to tell you a little bit about his journey and what will happen to him. So Nick and Cynthia, thank you for joining. I really appreciate you joining today and taking the time.
Thank you for inviting us.
And Mike, thank you for coming. So Nick, let's start at the beginning. And Cynthia is part of this story because she's his wife and you have some kids, right?
Yeah.
And, you know, this was not something you expected to happen, right? So tell us what happened.
So, it all actually started at work. I was seeing things and I ignored it thinking that I was dehydrated. And I got up, I had a conversation with some of my coworkers. They said the same thing. I'm probably dehydrated.
Yeah.
So I didn't think anything of it. It went away. I went home, went to sleep, ended up going for a walk, had no signs. The only real sign I had was being tired.
Yeah.
I went home, went to sleep, and at 3 a.m, I was woken up with a very terrible nightmare, and it woke me right up. My chest was burning.
Yeah.
When I opened my eyes, I was seeing things again. I wasn't just seeing things, I was hearing things.
Right.
And I couldn't explain what they were. I woke my wife up. I started to tell her, I think I'm actually having a panic attack.
Yeah.
And then when I looked over her shoulder, I saw my son there, and I got confused. I didn't know we had kids, which is a very alarming sign.
That's a lot, yeah.
And then when
imagine.
I looked at her and I went, we have kids. And I said, I'm confused.
Yeah.
And then that was it. She got up, and then I started to come back from it. And I told her to go get me aspirin. She ran, got me some aspirin. I popped the aspirin, and we started heading downstairs. And I believe I started having another heart attack. My legs went numb. My chest started burning. My jaw started burning. She got me to the couch. Now everything is starting to amplify. I'm starting to see more. I'm getting more scared. I feel my heart racing.
Yeah.
She's on the phone with 911. I got up again to actually go take another aspirin because my chest was burning so bad. So I walked into the kitchen and I had to stop. I put my hands on the table and the sensation started coming back again.
Yeah.
And I had to go lay down on the couch. I was having then trouble breathing. Both my hands started to go numb. And that's when she ended up actually getting me up and saying the EMTs are here.
Yeah.
And I started to go outside. She was holding my arm because I was having trouble walking.
Yeah.
I got into the back of the ambulance. They started asking me questions. And the thing is, they said my vitals were good. They went, your heart rate's a little elevated, but everything else looks good. And they said, we just think that you're having a panic attack.
So let me stop you here. So Cynthia, what is going through your mind at this point?
I was terrified for someone who doesn't go to the doctor, nothing ever bothers him, doesn't take ibuprofen, Tylenol, anything to say, I'm confused, we have to call 911. And just looking at his symptoms, I was terrified.
Yeah. Had you ever experienced anything like this in family members or anything like that?
No. Just having some medical background, I knew some of the signs to look for. I didn't see him sweating.
Right.
I didn't notice shortness of breath at first.
Yeah.
But again, the aspirin was our first go-to line of defense.
That's really smart. Where did you learn that?
Actually, the company that I work for, ASML. If it wasn't for them, I would have went back to bed.
That's really great. That's really good.
Yeah.
Kudos to them.
Yep. Kudos to them and their program that they ended up putting out there, the emergency response team, bloodborne pathogens, along with their CPR program. If it wasn't for that list that I started to think about, I would have went back to bed.
So, Mike, is this atypical? I mean, kind of being a little bit in denial of having a heart attack at this age?
Well, I think a lot of people have enabling fictions. So they definitely can find out why they have chest pain. Everybody denies a heart attack. It doesn't matter your age group. Even if you have risk factors, it's very common. What makes this obviously unique is your age. But people will say, I pulled my muscle from the gym.
Right.
I'm short of breath because I had a long work day and I'm tired and this makes sense. And then they end up finding out they ended up having some cardiac event. So very, very typical.
Yeah. So Naugatuck EMS brings you up to Waterbury Hospital and you get admitted into the emergency department. What happens at that point?
So I meet with a doctor, I believe a third shift doctor, and he said that we're going to end up taking you back for an EKG.
Yeah.
So as I'm waiting inside one of the waiting rooms, waiting for the EKG to be performed, I start hearing loud music. And I'm talking to the nurse, and the nurse is telling me there's no music. So at that point, they ended up rushing the EKG. I had abnormalities come back.
Mm-hmm.
I met with a doctor, Dr. Nakla,
Mm-hmm.
and he said that I did have signs of a heart attack. He said that there was I can't remember the name of the chemical, but he said there's a chemical compound coming back in your blood saying like it's getting higher and higher.
Yes,
troponin. Okay.
So, yep, that's it. And he said, I was going to wait, but I want to get you in for a cardiac catheterization as soon as possible. And I told him, please wait for my wife because she was waiting for somebody to look at her kids in case anything happened.
Yeah.
So when she ended up getting there, then they took me back. And then that was it. They found out that my heart was 99% blocked.
So tell us about the cardiac gap that Nick had.
Yeah. Very ominous looking anatomy. What he has commonly referred to as the widowmaker. So the front of the heart, the left anterior descending artery is the main artery for the left side of the heart. And that one was 99% blocked. In addition to that, he had blockages on the right coronary artery and then the one in the back in the circumflex artery. So very, very anatomically defected coronary circulation. And the sensations that he was having, very consistent with an evolving heart attack, which could have got worse. Heart attacks come in silent, small, medium, large, fatal.
Right.
We don't know how big. We don't know when. We do know in your situation, you're headed towards the big event.
Yeah. And so you have the catheterization done with Dr. Nakla.
Yep.
And then what happens?
My heart stops. So my heart stopped for a period of time. And I remember sinking back and falling through my body and seeing some things. I'm not going to get into detail about that because that's way too long.
Yeah.
But I saw some things, and the next thing I just I came back into myself with the Dr. Nakla on top of me, hitting me with the paddles.
Okay.
And then I went, what happened? And then he said, your heart stopped.
So you defibrillated.
Yeah, defibrillated.
In the cath lab.
Yeah.
In the cath lab. So you were brought back.
Yep.
And then stabilized.
Stabilized. Yep.
Mentally stabilized.
Yep.
So then he ends up where? And when do you get to see him?
Yeah, so I get to see him shortly thereafter, after the cath lab. We get a consult, and then I listed the patient, and we saw him at telemetry, actually. He was medically stable at that point.
Okay.
So they got him into the hospital, put him on telemetry floor, heparin drip, acute coronary syndrome treatment, and at that point, chest pain free, doing well. But given the anatomy and given the event of everything, we wanted to get him to the OR as soon as possible. So we planned, I believe, for the next day after we had met, we did do the bypass surgery. And quite an event for them, of course.
Yeah.
Young couple, newborn at the time, 3-month-old, other kids. So it was a lot to contend with to kind of corral everybody, parents, patient, wife.
Right.
Kind of get everybody on the same wavelength, because there is still a wave of denial at that point. We can't believe that this is happening to us.
Right, to a 35-year-old.
Right. Which is very normal. I mean, nobody wants to wake up and say, today's the day I'm going to have heart surgery. So,
yeah. So what does bypass look like?
Great question. So we do the bypass surgery here, which is an open heart procedure.
Mm-hmm.
What we do is make an incision through the center of the chest. And at that time, we borrow the artery from inside the chest wall to plug into what's called that widowmaker. Mm-hmm. We borrowed an artery from his arm called the radial artery, and the arm could do just fine with the collateral ulnar artery. Mm-hmm. And then we borrow a vein from inside the leg. And then what we do is plan our surgical revascularization. So the narrowing will go in the front of the heart. And then the other conduits, the radial and the vein, will go to the other parts that need a bypass. I like to say this to our patients that think about an accident on Route 84. So if there's an accident on exit 20, we get off on exit 18 and get back on exit 21.
Gotcha.
So we just permanently bypass that accident.
Gotcha.
And that's exactly what we do there. We leave the blockages where they are. We don't mess with the coronary arteries except just sewing in the conduit just past it. And the conduit is the actual graft that goes and takes the oxygenated blood to the heart and the rest of the muscle while it bypasses the blockages.
And so how long does this procedure typically take?
About 3 to 4 hours.
3 to 4 hours.
Yeah.
And then he ends up afterwards in an ICU.
Yeah. So he ends up in our cardiovascular unit, which is great because it's a one-stop shop.
Yeah.
And so the patients get to know the nurses who also get to know him throughout their shifts throughout the day. Family members know where he is at all times. They don't send people out all over the hospital after they, are stabilized in the unit. Like most places will send it to step down or wherever else.
Yeah.
So ours is one stop until he gets discharged home. It's a private room. We like it because we are very closely monitoring everything.
Mm-hmm.
The nurses are well trained. They have advanced practice practitioners, APRNs that manage the patients minute to minute, and is overseen by Dr. Poplaski and myself.
Mm-hmm.
And it's a good continuity of care, sense of ownership, sense of pride. And the patients really seem to like it because they get to know everybody, like I said. And it's a very easy transition recovery.
I imagine that it's a comfort to know everyone, to see such level of interaction with the patient. You're not moving around. And in a very difficult time, that can be helpful, right? So for you, Cynthia, what are you thinking when you hear he needs a bypass?
Right. It's like your life flashes before your eyes.
Yeah.
You know how serious that could be and what choice do you really have?
Yeah.
You worry about, healing process afterwards. And is this something is he going to be able to live a normal life? But I have to say, everyone was so great and walked us through the whole process. Just the amount of attention to detail and everyone's just caring was so noticeable.
Yeah.
So that made a big difference because you're terrified.
Yeah. I can imagine.
So
what's going through your mind after they say we're going to cut you open and do a bypass?
So I was angry for one, because I couldn't really believe it. But at the same time, my father came in and he ended up explaining to me that I lost this substantial amount of uncles that wasn't talked about. He never talked about it because I wasn't really thought yet.
Yeah.
So he explained to me that our genetics are terrible.
Yeah.
And I've had 3 uncles pass away within the same time frame that I have.
Okay.
And then I was just frustrated.
Yeah.
Because I thought I could end up solving my own family issues by trying to eat healthy, be active, hiking, lifting weights, and no, I couldn't stop it.
Yeah, you can't stop your dreaded
No,
right?
nobody.
But so how are you feeling now?
I feel amazing.
Yeah.
Yeah. So I thought I felt amazing before surgery. I have to thank Mike Nolan because I feel amazing. I've no out of breath, nothing.
Yeah.
And I thought just being out of breath before this whole incident happened, I was just out of shape.
Yeah.
And now since I've had it done, I feel great. It's crazy.
That's great. And so you're back to your normal life.
Yep.
Except better.
Yeah.
Really.
Yep.
better.
Much better.
Much better. Yep. That's great. What a great story. And this is a story that illustrates the kind of care and the kind of capabilities that are available right here at Waterbury Hospital, and the talent, the amount of talent that we have. I call it Mighty Waterbury Hospital. We're like this amazing place in the center of Waterbury, and we take care of people from all over. I want to thank you for joining. Mike, thank you for coming.
My pleasure. Thank you.
And Nick and Cynthia, thank you for taking the time to share your story, because I think it's going to be important for other people who may be in your situation, who may be denying whatever it is going on. Go in, get checked out.
Yep.
Make sure you're okay. Hopefully it'll be nothing, but if it is something, we have the capabilities and the talent to take care of you. And that's the story. So I want to thank you all for joining. Thank you to Nick and Cynthia, and thank you to Mike Nolan and everyone involved in our cardiovascular team here at Waterbury Hospital. We'll see you next time.
Thank you.
Thank you.